let's start. So here's my screen for the intro for this one. This is Global Views of COVID-19. This is the series. I have one more scheduled in the series after that, and I might do one other one after that if I can find a couple of countries with good examples of opening up, but we may just end it on Saturday with the Europe one, talking to European teachers. We'll see. Everything's up in the air. So this one today is challenges for individuals with pre-existing health conditions and migrant workers in Kazakhstan. That came out of a conversation I had with the speaker a few weeks ago when we scheduled this, but each one, if you've been on others, is sort of taking a theme that shows up in the US or two themes and looking at how they play out in other places. So here you see the Johns Hopkins map from just a little while ago, just about an hour ago, I think. And this is the reported numbers in Kazakhstan right now. Okay, so I'll just do a quick intro of myself. This one is being co-sponsored by the Inner Asian and Uralic NRC, that's a National Resource Center. And so I'm gonna give Kasia a chance to introduce herself, but this is not just Orias today. And then we'll have the talk, and then after about 25-30 minutes of a presentation, we'll move to Q&A. And again, per usual, if you guys are willing and able to stay on for a closing poll, that would be great. The slide deck has resources and future professional learning with this group I'm a part of on campus, but I probably won't get to that, just so you know it's there. Okay, so I made this fancy slide. I'm Shane Carter. I am the program coordinator for ORIAS, which is the Office of Resources for International and Area Studies. So I represent 8 different area studies units on campus, research units on campus. And in my role, I do programming for K-12 and community college instructors across disciplines. The one thing that everything has in common is that it has an international focus, and I just pulled out a series of things from my website right now, but you can look at any time. You'll get a follow-up email from me. It'll be easy to find. And so this series that we're doing right now is sort of my response to the current pandemic, with the idea of helping teachers understand it in a global rather than just a local context. My partner in this today can introduce herself now.
Hi, my name is Kasia Riedel Johnston. I'm the Assistant Director at the Inner Asian and Uralic National Research Center. And I hope the closed captioning will not give up on my non-native accent. As you can see in the slide, our center covers a huge swath of land, starting from Europe, as Finland, Estonia, Hungary, through Turkey, Iran, Afghanistan, all the stans, former Soviet republics, Tibet, Xinjiang in China, both Tibet and Xinjiang in China, up to Mongolia. We work as all national resource centers, we work with teachers. That's the absolute priority of the grant. In the current cycle and in the previous cycle, we've also worked with community colleges, minority serving institutions, and historically Black colleges. We provide lesson plans, we do presentations, virtual and in person. We visit schools. We do a lot of teachers workshop. Actually, in June, we are having a workshop on DGSs, the UN Sustainable Development Goals. Please check our website here at the bottom of the slide. We also have several collaborators among the community colleges and minority serving institutions. We have a competition on development of new courses. We do workshops for faculty. We have even taken some faculty from St. Louis Community College to Finland for a study tour. I think I should end here so that we can give voice to Alyssa.
Okay, thank you.
Thank you.
And I'll send the slide deck, the link to the slide deck in the follow-up email for everyone. So that will be a live link for you there.
Thanks everyone for tuning in today. I'm Alyssa Davis. I'm an assistant professor at Columbia University School of Social Work, but I'm an epidemiologist by training. And my work primarily focuses on developing HIV and sexually transmitted disease interventions to reduce these diseases among vulnerable populations, including people who inject drugs, racial and ethnic minorities, and sexual minorities. Most of my work focuses in the US and then also internationally in Central Asia, and in particular in Kazakhstan. So that is the region that that's the country that I'll be talking about today, and specifically challenges faced by individuals living with HIV and TB, as well as migrant populations. So just to orient you to the region, Kazakhstan is located on the southern border of Russia and the western border of China. It's the farthest north of all the former Soviet Central Asian countries. It's also the richest post-Soviet Central Asian country because it has a lot of oil resources. And so many migrant workers from the other post-Soviet Central Asian countries, which are substantially poorer, will come into Kazakhstan to work and earn money to send home to their families. As you can see, Kazakhstan is also not that far away from Afghanistan, and so it receives quite a fairly significant trafficking of opioid through the region, which means that a lot of people are injecting drugs, which is partially driving their HIV epidemic in the region. It's the 9th largest country in terms of land mass, but they only have a population of 18 million people, so their population density is quite low, which given the COVID-19 pandemic is a good thing for them because it helps reduce spread. So another important thing to talk about given our discussion today is that Eastern Europe and Central Asia is the only global region where HIV incidence is still continuing to increase, and that's largely due to injection drug use, but sexual transmission also plays a role. In all other global regions, HIV incidence rates have stabilized or have decreased. So data from UNAIDS show that in 2016, HIV incidence rates in Eastern Europe and Central Asia were 60% higher than they were in 2010, which is a huge increase. Whereas in all other regions, incidence rates had decreased. So for example, in East and Southern Africa, they decreased by 29%, largely due to a lot of funding that we've given to the region and HIV prevention and intervention programs that have been established there. On top of the HIV epidemic in the region, Eastern Europe and Central Asia also has extremely high rates of tuberculosis, and in particular multi-drug resistant tuberculosis. So according to the World Health Organization, Kazakhstan is among the 30 countries worldwide with the highest burden of multi-drug resistant TB. So this means that they have really thousands and thousands of people who have a severe respiratory illness that we don't really have treatment options for. So just to give you a comparison, TB incidence rates in Kazakhstan in 2018 were 68 per 100,000, whereas in the US, they were only 2.8 per 100,000. So they really have a much higher incidence rate than the US. Also, about 27% of their new TB cases in Kazakhstan are drug resistant, and 64% of previously treated TB cases are drug resistant. So many people have been infected multiple times, which can cause really severe damage to their lungs, even one infection. But the more they become infected with TB, the more likely they are to have drug resistant TB. It's also very common in Kazakhstan for individuals to be co-infected with both HIV and with TB. So then we have individuals who have a compromised immune system from HIV and who are already battling a severe respiratory illness for which there are limited treatment options. And these people are very vulnerable when it comes to COVID-19 infection. They're much more likely to have severe complications or to die from COVID-19 if they're infected. So this is from the New York Times. This is from a few days ago, from April 26th. So the numbers have increased since then. But you can see that the number of COVID-19 cases in Kazakhstan is relatively low compared to some other regions. So as of April 26th, there were almost 1 million cases in the United States, but in Kazakhstan, there were just over 2,600. As of today, it's about 3,500. But it should be noted that in Kazakhstan, testing isn't widely available. So these numbers are likely an underestimate, and actual infection rates are likely higher, although not as high as the US likely. And you can see from the map here that areas with the highest number of cases are located in the biggest cities, as is the case in other countries. So these data are from Monday from the Kazakhstan Ministry of Health. So again, they're a few days old, but they give you an idea of the trends. So Almaty, which is this green dot in the bottom right of the screen, is the largest city in Kazakhstan and has the highest number of cases, followed by Nur-Sultan, which is this red circle up at the top, was formerly known as Astana and is the capital, which has the second largest number of cases. And then Shymkent, which is the green dot down at the bottom, is also a large city in Kazakhstan and also has a fair number of cases. And you can see in the map that the cases outside of the major cities are comparatively low. So for example, Almaty city has 814 cases, but Almaty province has only 86. And early on in the pandemic, Kazakhstan blocked off the cities from entry or exit. So people living outside of the city and the provinces couldn't go into the city, and people living in the city couldn't leave to go out into the countryside or other small towns in the province. So that's why the Kazakh Ministry of Health splits the data between major cities and the rest of the province. So Kazakhstan implemented lockdown measures early on in the pandemic to try to contain the spread of COVID-19 because they have more limited healthcare infrastructure. So they started implementing lockdown procedures roughly around the same time we started implementing procedures here in New York City. And major cities were locked down and roadblocks were set up so that people living outside the city couldn't come in, people in the city couldn't go out. They would be stopped by police if they tried. And movement within the cities was also restricted, much more so than has been the case here in the United States. So residents are only allowed to leave for essential reasons like buying groceries or medications, but they have to stay within 2 kilometers of their apartment. So even leaving to go to the grocery store, it has to be close by. Minors can't leave home without being accompanied by an adult, and everybody has to wear masks when they leave the house. Non-essential businesses are closed, public transport reduced capacity by 50%. And if you're an essential worker, you have to have a permit for your car in order to be able to drive around the city, or a permit on you if you're taking public transport or walking to work in order to be able to go out and about. If you don't, you can be fined by the police. Large gatherings or gatherings of more than 3 are prohibited. And if you violate lockdown measures, the police will fine you or can charge you with imprisonment terms. Kazakhstan also built overflow hospitals or modular hospitals specifically for COVID-19 patients. In several cities in Kazakhstan, they have not really had to use them yet, thankfully, but they are there. Kazakhstan has also incorporated a lot of restrictions on international travel. So before, Kazakhstan had a visa-free entry regime for individuals from many countries, including the United States, where people could come, stay up for 30 days without a visa, and then leave. But now individuals from most countries need to submit certification of a negative COVID-19 test within the past 48 hours in order to apply for a visa to enter the country. And for citizens of other post-Soviet Central Asian countries, they're still allowing a 30-day visa-free regime. But for those hoping to stay longer, like migrant workers, proof of a negative test may be required. They still have to apply for visas to stay. So people living with HIV have additional concerns during the COVID-19 pandemic, and this is a vulnerable population that we work extensively with in Kazakhstan and that we are really worried about. And while people living with HIV in the US also face additional challenges around COVID-19, we're really worried about PLWH in Kazakhstan, especially given the high rates of comorbidity with TB. And also Kazakhstan only recently transitioned to starting patients on HIV medication immediately after diagnosis. And there are still many who aren't on medications, which means that their immune systems are likely compromised. So in the US, when someone tests positive for HIV, we immediately start them on HIV medications. And we do that so that we can decrease their viral load so that the virus doesn't weaken their immune system and doesn't cause more health problems for them down the road. We also do it because if we can get them virally suppressed, then they can't transmit HIV to other people, so it reduces further transmission of HIV. However, in Kazakhstan, until only very recently, they really didn't have enough HIV medications to treat all of the people living with HIV in their country. And so they had to establish clinical guidelines and cutoff points to determine who would be eligible to receive HIV medication and who would not. And so originally patients had to have a CD4 count lower than 350. And so that means these are people who already have very weakened immune systems in order to be able to be prescribed HIV medications. And then they raised the cutoff to 500. And then just a year or two ago, they finally got rid of cutoffs altogether, and they finally had negotiated drug procurement agreements to get enough HIV medications to treat everyone in their country, so that now if someone tests HIV positive, they will be immediately started on HIV medications. The problem, though, is that there are still many people who were diagnosed with HIV years ago who never started on HIV medications, who have now lived several years without being on HIV medications and think, well, why bother? I've lived this long without taking HIV medications. I feel fine. I haven't had a lot of problems. I really don't want to start now. And so these are people who likely have weakened immune systems and are at greater risk for acquisition of COVID-19 and developing complications if they are infected. And we think that people living with HIV who regularly take their medication and are regularly virally suppressed will be affected by COVID-19 essentially in the same way as people not living with HIV, but we don't really know that for sure. That's just what we think will happen. And because there are still so many people living with HIV who are not yet taking HIV medications or who take their HIV medications irregularly, and who have these other comorbidities like TB, we're really worried about this population and the impact that COVID-19 will have on them. And for people living with HIV in Kazakhstan, they themselves are worried about COVID-19 and what will happen if they get it. So many who are essential workers may not want to continue working and may want to stay home, but they're afraid to risk disclosing their HIV status to their employer. So in Kazakhstan, come up with programs for social benefits during COVID-19, where workers who are non-essential or can't work because of issues related to COVID-19 or pre-existing medical conditions that place them at greater risk are eligible to receive social support from the Kazakh government at least for a few months during the lockdown procedures and when things are starting up again. So they can receive the Kazakh minimum wage, which is about $121 US dollars a month. But at least it's something. However, people living with HIV who are essential workers might want to stay home to protect their health and reduce the risk of exposure, but they're placed in a really difficult situation because if they disclose their HIV status and their medical history to their employer, they might be able to take sick days or unpaid leave to stay home, which would reduce their exposure. But then if they do that, their employer might fire them and they may have difficulty finding employment again. So there aren't any labor laws in Kazakhstan to protect people from being fired for their HIV status, and that regularly happens. And so that's a concern that many of them have. Getting access to HIV medication can also be challenging and scary for people living with HIV during this time. So in Kazakhstan, they don't have prescriptions. The doctor can call the prescription into a pharmacy, but the patient still has to go there to pick up the medication. And if they're afraid of catching COVID-19, they may decide not to risk going to the pharmacy and just decide not to take their HIV medications during the pandemic, which puts them at other risks, because if they aren't taking their HIV medications, they may no longer be virally suppressed, their immune systems will become weaker, and they run the risk of developing drug resistance to their HIV medications if they're taking them inconsistently. So this is something we're trying to monitor among populations that we're working with and seeing how this is impacting their healthcare access. So I'm going to switch now to talking about migrant workers. Kazakhstan has increasingly become a main destination for migrant workers, especially those from Kyrgyzstan, Tajikistan, and Uzbekistan. And migrant labor is important both for Kazakhstan's economy and also for the economy of the migrants' home countries. So for many Central Asian countries, migrant labor is a huge source of GDP for them. In 2015, the World Bank ranked Tajikistan and Kyrgyzstan as the top 2 among all countries in the world for remittances as a share of their GDP. So Kyrgyzstan received 31% of their GDP from migrant remittances, and Tajikistan received 52% of their GDP coming from remittances. But the coronavirus has really wreaked havoc on migrants. They've caused millions of migrant laborers to lose their jobs in the region. Some are stuck between borders trying to get home as transportation options between countries and within countries have been cut. And then others who are still in their home countries, but then were planning to go back to Kazakhstan for seasonal work, don't know if they'll have seasonal jobs to get back to, or if they'll even be able to get back into the country. So remittances have plummeted, and we suspect that they will likely continue to be much lower this year and possibly into the next year than they were last year. The busiest season for migrant workers is just starting. So the busiest time is May through October, but job opportunities have been significantly curtailed and movement is restricted. So it's unclear how many families will be able to afford basic necessities if migrants are not able to go work. Migrants in Kazakhstan are largely poor and mostly accept menial low-paid jobs such as construction work, sweeping streets, and carrying heavy loads at city markets and stores. Of course, there are a smaller portion of migrants who are more educated and working in more skilled labor sectors, but for the most part, these are low-level, low-paid workers that don't have a lot of protections. So some are there illegally and they might fear accessing healthcare services if they fall ill, which is also a problem that we've seen here in the United States. Migrant workers in Kazakhstan are harassed by the police. They're also frequently exploited by employers. They are less likely to have protective gear at work, which is also another problem we've seen in the US. And migrant workers in Kazakhstan are more likely to live in tightly packed apartments or small living quarters, which make measures like social distancing basically impossible and puts migrants at higher risk for contracting COVID-19. And we've also seen this play out in the United States, particularly in New York City, where migrant neighborhoods have been disproportionately impacted by COVID-19. And unfortunately, it's unclear to what extent the restrictions on movement and border closures will continue to impact migrants as countries start to open up. So Kazakhstan is slowly opening. They're going to lift their current lockdown restrictions starting May 11th, but things will still be slow going. Transportation options are still limited. There will still be restrictions at the borders, although their policies are changing week by week. And so it's unclear what final requirements they will have for visa entries. But travel restrictions, and particularly if there are medical certificate requirements for migrants, it's going to be almost impossible for them to get COVID-19 tests in Central Asia right now to show that they're negative for COVID-19, which would prevent them from getting visas and getting work this summer. So as in other areas of the world, COVID-19 is likely to have long-term economic impacts in Kazakhstan, and particularly for populations of lower socioeconomic status and migrant populations. And it's unclear when or even if these populations will be able to fully recover from the effects of the pandemic. And so with that, I'll stop there and open it up for questions.
Okay, great. Thank you. I really appreciate that. And I appreciate the fact that you drew like direct connections to the US as well. Okay, so I'm going to start with the questions we have, but those of you who are still pondering and typing, that's totally fine. So I'm going to start with some kind of broader economic ones, which are two related ones. One was, what kind of work are the migrant laborers doing? Is there any mining, farming, or is it just, as you said, the other types of jobs? And then the broader question about that was, besides oil, what major industries does Kazakhstan have? I think someone was just trying to get a better sense of the economy as a whole.
Mm-hmm. So migrants are also involved in mining and farming. A lot of them will also bring goods that they've purchased from China or other areas and sell in marketplaces. So those are certainly other sectors that migrants are working in. Oil, I think, is the biggest industry that I'm aware of in Kazakhstan, but I know they do some manufacturing and also farming as well. But
okay, got it. Thank you. So I'm going to jump ahead to a couple. There were a couple of questions. So one is, are migrant laborers more or less likely to have HIV, or the same as the like local population of Kazakhstan? And then someone else asked, do a number of the migrants have HIV or TB, or were you just referring to those high numbers in the Kazakhstan and the Kazakh population?
Mm-hmm. So I was referring mostly to numbers. The numbers that I cited were from the citizens of Kazakhstan and from the Kazakh population. In studies that we've done with migrants in the region, we have not found higher rates of HIV or TB among this population. And in fact, the rates are higher among Kazakh citizens. We do find slight differences in terms of HIV infection by ethnicity. So Kazakh citizens who are from Russian backgrounds tend to have higher rates of HIV than those from Kazakh or other Central Asian minority backgrounds.
Yeah, interesting. Okay. Which is an interesting comparison to the US also about the kind of various pre-existing conditions in different populations in the US as well. Okay.
Yeah.
Well, that gets me to another question that's sort of related to that. Someone said this is an interesting comparison with the immigrant populations in the US. Are there ethnic tensions that are also similar to the US between migrants and local?
Yeah, so there are definitely ethnic tensions in Kazakhstan as well. Very recently, a few weeks ago, I believe, there was some rioting in southern Kazakhstan against a particular ethnic group there that crosses the border into Kyrgyzstan frequently, and they were worried about them bringing COVID-19 into the region, essentially. And so, yeah, there was fighting in the streets, and people were vandalizing other people's property, and it wasn't a great situation.
So the same, this sounds similar to some stuff we've heard in some others. Like we saw in the South Asia one, that pre-existing tensions between especially Muslim and Hindu populations in India got heightened by this, and we've seen it in the US in some areas as well.
Yes.
And so it sounds like the same thing. So it's like pre-existing tensions that are getting kind of written, like overlaid with this fear.
Yeah, I think unfortunately during pandemics are, pre-existing or underlying racism and stigma comes out in some ugly ways as people look for someone to blame for the problem.
Yeah, and particularly. Okay. So then these sort of get to the questions about Kazakhstan. There are two of them that are related here. One is that, I'll do them separately though, is the government of Kazakhstan stable enough and strong enough to help people, especially migrant workers who cannot work due to contracting COVID-19? I think the question is about like social supports and so forth.
Yeah, so their minimum wage that they're giving to people who can't work only extends to Kazakh citizens. So for migrant laborers who are trying to get jobs in the region, they won't get support from the Kazakh government, and they are really, just going to be severely affected by this. So in short, there's not support coming from the Kazakh government for sure. And I doubt there will be little, if any, support coming from their home countries to make up for the jobs that have lost. I mean, because Tajikistan, as of right now, for example, has not shut anything down for COVID-19. They just don't have the resources to do so.
Interesting. Okay, so they're right next to Kazakhstan, and so that hasn't shut down at all. Kazakhstan has. I want to deviate a little bit, and I don't know if you know the answer to this question, but there are really like big differences between the social supports in different countries. Do you happen to know you said that the Kazakh government is providing supports for people who can't work at least for a couple of months. Do you have any idea how significant that is or how sustaining that is?
So, I mean, it's minimum wage, which is not a lot. It's at least something. They have not come out with a specific timeline for how long the support will last. So it sounds like it will be at least a few months, but maybe longer, depending on how things go and what resources they have. I know Kyrgyzstan is trying to also provide some support for people, and they have locked things down. Turkmenistan, of course, is denying that there's even a problem, and Tajikistan has kept everything open.
Interesting.
So, yeah.
And okay, that's interesting. And I mean, the amounts that you're talking about are very small, but also the uncertainty. I think one of the differences as we're looking at different countries around the world is the different levels of certainty that people have about the help that's coming from the government and whether they'll be able to access it. I think a related one that also had to do sort of with Kazakhstan as its infrastructure is a question about the strength of their medical system, period. Do they have respirators? Do they have, like you said, that they built new kind of hospital areas, but how strong is that system?
Yeah, it's definitely not as strong, which is part of the reason why they started lockdown procedures so early, because they know they don't have a medical system like we do here in the West, or like there is in China. So they do have some respirators, but if the situation were to get dire, they would be, yeah, it would be problematic. A lot of people would die.
So they're doing a prevention. That's what we heard in the program just a couple days ago about Rwanda also, was like this very intense work toward prevention, because they knew that they couldn't handle a bump in that. Okay, so I'm going to ask a question about the treatment for TB and so forth, and then I just need to read and understand this question that I got about migrant workers also. But so one is, do you see the same types of compliance issues with TB drug treatments that require taking multiple drugs for a 6-month period, or is that different than the HIV one? I think part of what you said was interesting, was it wasn't just the stigma around treatment that was creating a problem for people who were immunocompromised, maybe because of HIV, but also just the actual mechanism of getting their treatment.
Medications. Yeah, so in Kazakhstan for TB, people are in the hospital for a while they receive treatment, and then they can, the next phase of treatment, they can take at home, but the same types of compliance issues apply, and even in the best scenarios, we have difficulty getting people to adhere to their TB medications or their HIV medication regimens. So medication adherence is always a challenge, but particularly now.
Yeah, I would expect so. And particularly difficult because TB medication is antibacterial, right? Am I confused about that?
Yeah.
Okay, yeah. So. Huaying, I'm going to ask you to please, in the chat box, could you, I will repost the question that you put there, and I'm just asking you if you could maybe reword it for me a little bit. I'm having trouble understanding. So I'll come back to that in a second. So one is sort of a broad question to kind of jump off on what you said before. How much else do you think migrant workers in Kazakhstan have in common with the migrant working populations in the US? Like, as you've been watching the news about this, what other themes have struck you as being similar?
I think there's a lot of similarities. So I think migrants face a lot of stigma and racism from, native country populations. They don't have social supports or a social network to catch them. They're, much more likely to be infected with COVID-19. They have no work protections or very little work protections, but yet they're also working in jobs that place them at higher exposure to COVID-19. And when they become infected, they're afraid to get care, or they don't have access to it. So I think there's actually a lot in common.
Yeah, I'm noticing some themes. We saw some also themes about migrant workers that were within India, but still really serious issues with the lockdown. Yeah. So I want to ask one more health related question associated with this. And then, because of course we're talking to a group of teachers, I have an education question for you. One is, and this was from me actually, is stigma around HIV reporting changing? Because you were saying that the government was like getting rid of the limits on, how low the viral, like when someone can start treatment. And so is stigma also changing? Is that better than it has been, or is it still an issue?
It's slightly getting better. I would say it's slowly getting better. So there are some HIV activist group and certainly researchers and health professionals who are working to combat stigma around HIV, but it really is a huge, huge problem. And it keeps people from accessing healthcare. It keeps them from disclosing to their employer because there are no protections. And for example, if you're HIV positive and you wanted to be a teacher, too bad. Like, there's no way they'll let you teach in a school. And a lot of other employers, if they find out your HIV status, will fire you. And there are participants we've had who've been, kicked out of their homes, and their families won't even talk to them anymore, particularly if they're from rural areas and they find out that they're infected with HIV. So it's a very difficult situation.
So that's interesting, because I think it's much more extreme. That one particular example is more extreme than many US situations.
Yeah.
But I do think that raises an interesting topic. It's sort of like the intro to an interesting topic, which I think maybe hasn't gotten enough coverage in the US, which is the intersection of pre-existing medical conditions, potentially some types of physical disability, the desire or need to maintain medical privacy, and then the predication of help upon disclosing, like you can't stay home
Exactly.
if X. And so I think that's a really, and that was actually, when we were talking, that's what I found so interesting.
Yeah.
That's very much true here too, in certain other instances.
Yeah, and I think, in the US, maybe they can't fire you for your HIV status, but it's also the case you may not necessarily want to tell your employer, but can you choose to work from home if you don't disclose that? And that's,
Well, I don't know if this question is in your wheelhouse, but I'm going to ask you anyway. Do you know what the situation is with Kazakhstan right now in terms of education? Are they teaching and learning online? Are they doing something else? Are you aware?
So I can say from experience with our Kazakhstan staff members who have children and are working remotely now. So their kids are doing online learning. It's not like in New York or some other places that are more well-resourced where you're like on Zoom calls all day. It might be just short periods during the day where they have online calls, and then others are just like homework packets that they're assigned to do on their own time. The challenge in Kazakhstan, as also in certain areas of the US, is that a lot of kids don't have computers, they don't have good internet access, so having them learn online all day is really, really difficult, particularly for students in rural areas.
Yeah, that makes sense. I just heard that this morning there was a news story that LA Unified was working with a public broadcasting station down there that had additional bandwidth, and they were broadcasting school stuff on public TV, which I was like, TV is, but even if then you might not also have a TV, but it's an easier lift than.
Yeah, I think it would be, yeah.
Okay, I have one last kind of really broad question, which Wai-Ying, I still don't see a rewrite of that other question, so maybe you feel like it was answered. But I thought that this, she asked why the focus on Kazakhstan, and I'm going to shift that a little bit because I know that just gets at what your research is. But I will say that when Kasia introduced me, what I found interesting was, one, it's a region of the world that we hadn't talked about yet in this series, but also I just was really struck by how similar some of the issues were that you brought up when we were talking about it. So that was the appeal to me. But do you want to in 2 minutes explain all of your choice to professionally focus on Kazakhstan?
Yeah, so I studied Russian in undergrad and lived in an area of Russia that was close to Kazakhstan, actually. And so I met a lot of different Central Asian populations in the city I lived in and became interested in Central Asia. And during my doctoral degree, my minor was in Central Asian Studies, and I actually worked with Kasia many, many years ago at the Inter-Asian and Uralic Resource Center. And then when I was applying for postdoc positions here at the Columbia University School of Social Work, we have a Global Health Research Center of Central Asia. And I thought it was wonderful. It was my regional background, and it was a way to merge my background in epi with my interest in the region. And so I had the fortune of coming here, and I stayed here and applied for grants and continued to work in the region. And social work is kind of not my disciplinary training, but I do enjoy working with social workers. They're a very passionate group of people focused on addressing health disparities and racism and social inequities. And in Kazakhstan, social work is a very new profession. So it's been interesting to see how that profession has started to grow there and how they've started to work to try and make changes in their society.
Okay, thank you.
Yeah.
All right, you guys who are on, would you like, we have time, if I have one more question, we have time to do that. But if you don't have another question, then I will wrap things up. I'll wait for a couple seconds to give people a chance. I'm also looking back to make sure I didn't forget anything.
Oh, I see one more question.
Okay. Oh, okay. So yeah, Chris says, is Kazakhstan more vulnerable than the other stands?
I think they are better situated to deal with COVID-19 actually than a lot of the other stand countries who are poor and less resourced. Because in the other post-Soviet Central Asian countries, you still have migration going through those countries and people are still traveling there, but they have even less health resources to detect cases and to treat cases. So although migration through Kazakhstan might be higher than other regions, they have more infrastructure to deal with it.
I just want to, I do have one final question actually, since we've been hearing about like different versions of stuff. Is there anything about the procedures that Kazakhstan adopted about like closing cities but not rural areas, whatever other procedures that they adopted that you think were particularly, like as you're looking at them now as an epidemiologist, that seemed particularly, I don't know, deft or smart or good in terms of their situation?
I think it was smart that they acted early, particularly given their limited healthcare infrastructure. I do think because it's Kazakhstan, they were able to put more restrictive measures in place that we would have a difficult time doing here in the US. So in Kazakhstan, they also like disinfect streets at night with, I don't actually know that that's that effective, but on the other hand, I guess it gives people kind of a sense of calm and feeling that the government is like doing something and is invested in their health. But I think Kazakhstan still will struggle with the same challenges that we will. Hopefully they acted early enough that they were able to curb the infection rate, but the economic fallout from this is still going to be really hard
For them.
Yeah.
Okay.
Yeah.
All right. Thank you. I don't think that's necessarily a positive note, except for, I don't know, we're all in it together.
Yeah.
The globe, we're all experiencing this. Oh, someone else added, do you think that type of nightly disinfection inspired Cuomo's decisions about the New York City subway?
I don't know. I mean, I don't know how familiar Cuomo is with with Kazakhstan. I feel like there are other countries who have also done disinfection activities.
It was that type of, but not necessarily.
Yeah, it would be great if he, was inspired by that. But I'm not even sure if he knows necessarily where Kazakhstan is.
Yeah, it is interesting though to see like these procedures sort of rounding the globe, and then different countries pick up different ones. I know that in some places they spray the disinfection on people, which creates all kinds of lung problems, which is not the same thing. But it's been an issue in certain countries. Well, I want to say thank you, and Kasia, I want to say thank you to you too for being my connection.
Thank you. Thank you.
Okay. And Alyssa, thank you again so much.
Yeah, you're welcome. Thank you for inviting me.
I appreciate it.
Thank you, Alyssa.
Yeah. Bye.
All right, everyone have a great night. I'm ending the meeting. Bye-bye.